watershed area, feeding the Magat River, the largest tributary of the Cagayan River, and traversing one of the few remaining primary forests in the Philippines. Local residents barricaded against the entry of the company in their lands, leading to violent dispersal and injury of several indigenous persons, mostly women. And this line of defense against development aggression is also a line of defense against disease and their spread. Land use changes and deforestation disrupt this balance in relationships between nature and people. This is true in natural systems or in industrial food systems, which create conditions for animal pathogens and diseases to transfer to people. So I can see exactly how these relationships are true in the Philippines.
Thank you, Georgie. It sounds like some fairly horrible things going on there, both for local communities and with potential spillovers far beyond. Looking more sort of on the positive side, it's been suggested, as I mentioned earlier, that if Indigenous people and local communities have stronger land rights, then that could be one of the most affordable options for preventing the kind of spillover conditions that Eric mentioned earlier from wildlife. And could you talk a little bit about the potential for doing that?
Yes, as I was mentioning earlier, territorial governance and customary use by indigenous peoples have safeguarded much of the remaining biodiversity. So yes, it is affordable because it is carried out through the collective actions of community members, often without direct financial contributions by the government. But this guardianship remains precarious and land rights are not secure, despite the existence of the Indigenous Peoples' Rights Act in the Philippines. Implementing this law will require budgetary contributions for delineation, demarcation, and restoration of community lands and support for community self-determined development. Indigenous peoples have become impoverished by the current economic model. The government continues to promote mining, which is extracting local wealth and causing destruction of ecosystems and communities, which requires very expensive remediation. The costs of addressing biodiversity loss and climate change impacts are far more expensive than preventing these global problems. In much the same way that curing pandemics when they occur is much more expensive than preventing them, the incentives given to destructive projects far outweigh the meager financial support flowing to indigenous communities for our vital contributions. So affordability may be one criterion for supporting indigenous people's land rights to protect nature and prevent pandemics. But taking a broader view and other values into account, securing indigenous people's land rights is also one of the best ways to address systemic and structural inequalities which are at the root of our planetary crisis. The weakness of an instrumental approach towards indigenous peoples, for example, just focusing on affordability, is that the full values of cultural diversity and our other contributions may be overlooked. For example, many indigenous peoples are prioritizing revitalization of indigenous food systems to address the current biodiversity and health crisis. So this nexus between food, ecology, health, and culture is at the heart of an indigenous food systems approach, which links the well-being of the planet to the well-being of people through sustainable and healthy diets. Indigenous homelands are rich in species and genetic diversity compared to surrounding lands. The full values of these lands are actually priceless contributions by our peoples.
Thank you, Joji. You put that very well. You wrapped all the different elements together. This is definitely not just about affordability, though unfortunately it seems affordability is one of the driving forces. There's so much more to that. And in a way, the culture is wrapped into a more healthy relationship with nature. When we lose the culture, maybe we lose that relationship. So I think that's a really important area of discussion. I will now move. We've heard from Indonesia and Southeast Asia. Let's cross the Pacific there and hear what's happening on the ground in Brazil. Let's hear from Francisco on. I mean, obviously, Brazil is one of the hotspots of the pandemic. 439,000 people have died in Brazil. A very high number of them, proportionate to the population, are indigenous, quilombola, or from riverine communities. Francisco, bom dia. Can you please explain how? Can you please explain how indigenous people in Brazil are coping in this situation?
É um desafio muito grande, né? Primeiro, bom dia a todos. Quando, né, no Brasil a gente tem um número muito alto de mortes, né? Nós chegamos a 440 mil. Então, isso representa bastante para nós. E indígena, nós já atingimos mais de 1.000 mortes. Então, nós, povos indígenas, em várias partes do Brasil, estamos lidando com uma outra situação, que não é só a pandemia, né? Mas a falta de uma estratégia, de um compromisso do Estado em definir melhor a estratégia para proteger os povos indígenas. Então, a gente tem feito muito internamente as nossas comunidades, né? Tem trabalhado para que a gente se proteja a partir dos nossos conhecimentos tradicionais, porque não é a primeira vez que a gente lidar com pandemias. Nós, historicamente, já vivemos muitos momentos difíceis como esse. E a gente tem muitos conhecimentos também, né? Da medicina, da floresta. Então, muitos casos, né? Talvez a gente salvou muitas vidas por conta desse conhecimento que os nossos povos têm. Então, a gente fez uma estratégia de isolamento e também trabalhamos bastante para que nós fôssemos, através da medicina, se imunizando, tomando para se proteger alguns chás, né, conhecido pelas nossos pajés, as nossas lideranças espirituais. Superamos, né, estamos administrando com essa dificuldade, mas perdemos muitas lideranças importantes. E falando mais da Amazônia brasileira, temos também está coincidindo com o momento de uma crise muito grande que nós estamos vivendo, de um desmatamento muito grande que está acontecendo na Amazônia. Isso é muito assustador. Parece que está muito combinado com essa pandemia, com esse momento da pandemia, um outro ataque muito forte, e nós, comunidades indígenas, estamos passando, trabalhando duro para que a gente vai combatendo essas duas questões que são muito violentas para nós. Temos, né, muito claro, o nosso povo entende, né, talvez na linha que já foi colocada aqui, de que quando a floresta ela está intacta, bem cuidada, e nós dentro da floresta, nós estamos bem protegidos. Na medida que você vai alterando os nossos caminhos, nossos rios, nossas florestas, o nosso ambiente, nós começamos a ficar mais vulnerável. E a partir daí começam a vir as preocupações. O grande desafio nosso é manter, né? Lutamos para ter por direitos a terra, né, por direito à proteção desse ambiente, da biodiversidade. Foram conquistas importantes que hoje também estão ameaçadas, né? Estão ameaçadas porque nós temos, né, um Estado que não está dando conta de proteger, né, de cuidar desses direitos que nós conseguimos, ao longo do tempo, colocar na Constituição Federal. Então, essas ameaças, elas também impactam muito a nossa vida. Então, na medida que esses direitos vão sendo violados, não vão sendo respeitados, o nosso modo de vida, né, não for respeitado e começa a vir uma pressão externa, né, por interesses, né, externos, passando por cima das nossas casas. Floresta é a nossa casa, né? Nossos rios, os nossos caminhos. Então, ali é bem completo. Nós trabalhamos para manter isso, porque isso é o que dá sustentabilidade para o nosso povo. E estamos passando por esses problemas. E a gente sabe, né, que, na medida que isso começa a ser alterado, começa a ser destruído, o nosso povo vai junto. Então, nós trabalhamos todos os dias da nossa vida para que o Estado ajude a nos proteger, porque a nossa parte nós estamos fazendo e compreendemos que qualquer alteração, ela representa ameaça para nossas vidas, seja ela através da pandemia ou de outras mudanças climáticas que pode acontecer nas nossas vidas, e a gente talvez não esteja preparado para acompanhar, ter um ritmo de se adaptar para as mudanças que vêm.
Muito obrigado, Francisco. You have already answered the second question I was going to ask you, which is, what would be the value of protecting or strengthening indigenous land rights in terms of helping to reduce the risks of disease spreads? I mean, I suppose I've spoken to several epidemiologists recently, and they've said they're very worried that perhaps the next epidemic could come from the Amazon, because there's so much deforestation happening there. Well, you've already answered my question, so maybe briefly a different question. This would be, do you think people in Brazil are starting to realize that there is a connection between destroying nature and becoming sick?
Eu creio que uma parcela bastante grande. Primeiro, a ciência já tem se alertado a sociedade sobre isso. Tem muitas, né, pesquisas já realizadas. Acredito que as universidades, né, a parte jovem também, né, deve estar sentindo, né, um pouco dessa necessidade de compreender melhor. Mas ainda está muito longe, né, das pessoas, do povo brasileiro, assumir a importância que tem a Amazônia para a sua própria vida, para o seu bem viver, né, para manter uma produção que hoje existe, seja em qualquer área que o Estado brasileiro sobrevive. Tá muito longe de entender isso, porque se percebe que ainda não tem força o suficiente para enfrentar essas crises, para orientar o Estado brasileiro a cumprir com essas obrigações que ela tem. Então, isso, né, a pressão internacional tem influenciado muito aqui no Brasil para que o povo brasileiro possa né, chamar para si essa responsabilidade. Alguns ainda ficam achando que o mundo está se metendo na vida do Brasil. Eu acho que não é se meter, eu acho que nós temos uma responsabilidade global de onde a gente está preocupado com o bem-estar do planeta, porque é a nossa casa. A gente compreende, como povo axanenca, né, que temos que agir juntos, porque vai dar um efeito, né, que não vai... todos vão pagar o mesmo preço. Então, a gente entende que é um processo que tem que ser muito mais forte, essa questão de defender essas questões, porque no ritmo que está indo aqui no Brasil, as questões ambientais, né, o de respeito aos povos indígenas, a não valorizar esses conhecimentos, nós corremos o risco de a Amazônia virar um problema para o Brasil e um problema para o mundo, porque a partir do momento que ela deixar de fazer o serviço que ela está fazendo hoje, quando ela desaparecer, as consequências vão ser muito grandes para o Brasil todo e para o mundo também. Então, a gente está trabalhando para que haja consciência disso. Não tem outro jeito. Tem que ter um Estado preocupado, tem que ter o povo brasileiro preocupado, porque nós somos tão ricos de conhecimento. Nós mesmos que estamos na floresta, a gente ainda precisa, depois de muitos séculos né, que vive dentro da floresta, ainda tem, a gente descobre todo dia coisa nova, né? E imagina quem nunca pisou na floresta, quem nunca conhece a floresta, só vê a floresta por cima como uma coisa verde e mais nada. Entende que tem árvore, entende que tem biodiversidade, mas é muito mais do que isso. Tem uma espiritualidade que precisa ser compreendida também. Então, eu acho que nós precisamos agir respeitando todos os continentes, todos os países com as suas diversidades de culturas que têm, mas também com uma responsabilidade para cuidar da nossa casa, que é esse planeta.
Muito obrigado, Francisco. Muito obrigado. I think you've really brought across that important point that people starting to understand, but not nearly enough. More international pressure is needed. Clearly, webinars like this on this topic, I think this, it's why it's so important, and there needs to be a lot more. So thank you very much for that. We'll now move to Carlos. Hi, Carlos. Now, from more the science perspective and a sort of more global perspective, before the emergence of the COVID-19 pandemic, a 2015 paper from EcoHealth Alliance suggested that land use change was the leading driver for emerging zoonosis. Can you tell us a bit more about this study? I mean, we kind of semi-predicted that this might happen or something like this. Please tell us some more.
Great, thank you so much for the question. I will reply in Spanish, if I may. So I'm going to switch there. Gracias por la pregunta. Sí, nosotros estamos trabajando con el tema de enfermedades infecciosas y principalmente el tema de deforestación y el tema de cambio en uso de la tierra. El estudio que te refieres en 2015, lo que nosotros hicimos fue hacer una lista de todas las enfermedades que aparecieron por primera vez en poblaciones humanas desde 1940. Entonces, por ejemplo, la primera vez que el ébola saltó de algún animal en África a humanos, ese es un evento, es el primer evento que podemos que pudimos encontrar. La primera vez que, por ejemplo, el VIH saltó de primates a humanos es un evento que estamos investigando. Para cada evento tratamos de entender qué fueron los factores detrás que pueden explicar qué pasó en ese momento. Algo importante de recordar es de que importante de aclarar es de que las enfermedades, como bien Eric mencionaba, las zoonosis están presentes la mayoría vienen de animales de vida silvestre a humanos, ¿no? Pero la clave de esto es la interacción entre humanos y vida silvestre. Esta interacción, esta conexión, cómo nosotros los humanos interactuamos con vida silvestre, determina cómo va a ocurrir esta aparición de enfermedades, este salto de vida silvestre humanos. Entonces, para cada caso nosotros examinamos y tratamos de entender qué factores estaban detrás de la aparición, por ejemplo, otra vez del ébola saltando a humanos. En la mayoría de los casos es porque hay un cambio fundamental, un cambio importante en el paisaje de estos lugares, por ejemplo, deforestación. Ahora, deforestación puede ser medida de distintas maneras, como por ejemplo la pérdida de bosque, pero también es la fragmentación, ¿no? Dejar pedacitos chiquitos de bosque aquí y allá. O, por ejemplo, la expansión de la parte agrícola, ¿no? Por ejemplo, más plantaciones de aceite de palma o plantaciones, no sé, de ciertos productos que tienen demanda mundial. Y también importante es la expansión de la parte agrícola, ¿no? El mundo estamos comiendo mejor, comiendo más, y demandamos en general más carne para consumir. Entonces, la demanda de carne, por ejemplo, en Europa o en China, causa deforestación en el Amazonas. Entonces, esas demandas es lo que está poniendo la presión en estos lugares. Y al deforestar más, hay más gente trabajando en estos lugares, interactúa más con vida silvestre y de esa manera hay más probabilidad, más chances de que un virus que no conocemos o que sí conocemos salte a humanos.
Thank you, Carlos. Very important the way you linked the local outbreaks and global pressures to eat into rainforests and other biologically rich environment and create new interfaces, as Eric described them, where these interesting things happen that start to cause problems in a much wider area. So thank you for elaborating on that. And then the question that we're asking everyone, the fundamental question here for this webinar is how can stronger indigenous land rights help to reduce these risks or manage these risks? And maybe you could also tell us a little bit more about the study on this subject recently by IPBES. It's basically the UN's collection of scientists to study biodiversity. They looked directly at this link between biodiversity and pandemics. So maybe you could tell us a little bit about that as well. Thank you.
Great. Thank you so much. I will keep this now in English to streamline the discussion. Yes, the IPBES report on pandemics and biodiversity and pandemics, we look at what is the evidence that link biodiversity and the emergence of infectious diseases. So one of the important discussions that we put there is the role of indigenous territories to prevent pandemics. So we need to understand that indigenous territories, most of the diversity of the world exists in landscapes that are traditionally owned by indigenous people and local communities. So that it's extremely important to understand from this part, from this landscape. This landscape, it has the biodiversity is slowly declining in these areas. So there's less biodiversity loss inside these areas. We're preserving better biodiversity. So, but also, these territories indigenous are suffering from a lot of pressure around these areas for the expansion of agriculture, for example. And so these areas can really preserve biodiversity for any reason that you may think, even for future generations, even for genetic resources, natural resources, or just by the fact that we want to preserve biodiversity. But also there is another co-benefit of having territories, indigenous territories, which is the maintenance of human health. So indigenous territories provide another service, which is again maintenance of human health. For example, we've seen that deforestation is directly linked to the increase of malaria, especially in Brazil and in Malaysia and in other countries that we are working on. By keeping the forest, like low disturbance forest, then we reduce the number of the cases of malaria in this region. And that has, benefits for the people in general, but also reduces the costs of the government that they need to invest to treat people with malaria. So this is just one example. This is just one disease. Think about other diseases that Eric mentioned before. So there is an accumulated saving benefits, that economic benefits that they can be, we can gain from keeping indigenous territories. Finally, I want to mention that we need to start thinking about indigenous territories as a network, not just an isolated area in somewhere in Brazil or somewhere in Africa or somewhere in Southeast Asia. This can really, as a whole, can help to protect the human health for everyone. We need to take advantage of the protected areas in general overlap somehow with indigenous territories. And having this network, global network of well-managed forests can really help us to save our health, our human health, but also can help the economy of each country.
Gracias, Carlos. I thought that was very exciting, that last point you made of really thinking in terms of an indigenous network, not one piece here, one piece there. I think to some degree that has started, but it's not nearly recognized enough. And this year when we have big COP events for climate in Glasgow, for biodiversity in Kunming, I would love it if this was discussed more fully, because I think too often indigenous and traditional communities are very wrongly seen as sort of like backward or whatever way you want to put it. They put it in a pejorative way, but this is nonsense. They're specialists on protecting biodiversity. and it needs to be thought of in those terms. It's like super specialists who've contributed a lot to biodiversity in the forest. So thank you. I really found that very, very stimulating. Now, our last speaker, Gladys, we turn to you now. It would be great if you could tell us from the programs that you've been working on and the work that you do, what would be your recommendations for preventing zoonotic diseases in local and indigenous communities?
Yeah, thank you very much for inviting me on this webinar. I would say that, we championed a One Health approach as early as 2003, based on experiences I had working as a first vet for the Uganda Wildlife Authority. And the reason they had a vet actually was because they were very concerned about diseases spreading from tourists who were coming to visit critically endangered mountain gorillas, which at the time were only about 650 left in the wild. They were concerned about a fatal flu such as COVID-19 spreading to them, and they felt they needed a veterinarian. Up to that point, everyone thought that wildlife, should just be left on its own and it should be natural selection. But very soon when I started working, I found out that community health was very important for protecting wildlife, because within 9 months of my being hired, we investigated a skin disease outbreak, which turned out to be scabies in the gorillas. The baby gorilla died and the rest only recovered with treatment, but it came from people, the local communities living around the park. So the gorillas went outside to eat people's banana plants, because once they got habituated for tourism, they lost their fear of people. And then they went back to range where they used to range before. And, you know, Bwindi, when it was created as a park, it used to be a forest reserve where people could cut trees. Actually, there were indigenous people living there, the Batwa community, but unfortunately, they had to be taken out in order to create the park. And they were put in settlements and they're being looked after by various NGOs, but they felt that they couldn't have them there when tourists are also entering the park. Although surprisingly, they used to protect the wildlife because they had this belief that if you look in the eyes of a gorilla, it's bad luck. But when it was created as a park, it was better to put them, the government thought it was better that they stay outside so that it doesn't disrupt the activity. But a lot of the money from tourism also goes to the local communities. So when it was traced to people living around the park, we set up an NGO a few years later, Conservation Through Public Health. It's also a US registered nonprofit, because we felt that you can't protect the wildlife without also improving the health of the communities. So though a lot of people think of zoonotic disease as only spreading from animals to people, there's also zoonotic diseases that spread from people to animals. And that has been our main focus. But one thing that we've also realized that why do we have such zoonotic diseases? You know, they also have a high prevalence of tuberculosis. They also have, you know, because they have poor hygiene and sanitation, so they're more likely to get all kinds of infectious diseases. And they also eat bushmeat. And bushmeat has, you know, there have been Ebola outbreaks in Central Africa, gorillas that have died of Ebola, or chimpanzees, people who ate them died of Ebola. So disease goes in both directions. And one thing that we do at CTPH is, on top of preventing diseases by looking at comparative pathogen analysis between people, wildlife, and livestock, we also very much focus on behavior change communication, where we basically work with local communities, and from them we select community health workers. It's done transparently with their local leaders, and these community health workers are trained to do conservation work. So as they tell people not to, you know, to be healthy and hygienic, not to poach, because poaching also results in picking up diseases from wildlife. They told them not to cut down trees, protect the forest. It's an important water source. When you protect it, you're also less likely to get diseases. So it's a whole package which goes towards them. And because it comes from people within their community, it's not imposed from someone elsewhere, from within Uganda or from another country, they're more likely to change. And we've seen a lot of behavior change. And I believe that the way forward is by putting communities at the forefront of changing and making their lives better, not imposing from elsewhere, but having a bottom-up approach. And through it, we've even had the Batwa, because we mainly have around Bwindi forest where the mountain gorillas are found, mainly by Bachiga, but the Batwa who are evicted from the forest, they have village health and conservation teams among them, basically community health workers doing conservation work as well. They basically are changing the communities in their settlements. And one great thing that has come out of the pandemic is that because they're worried about getting COVID, which has been a focus of our work when the pandemic began, stopping people from getting COVID through improving hygiene, mask wearing, and social distancing. The number of hand washing facilities has gone up outside people's homes. So I really believe that behavior change communication is a very good way of getting indigenous communities to prevent zoonotic disease transmission.
Thank you, Gladys. Really interesting points. Many struck out, but among them were this idea that this transmission is a two-way street, and we can harm nature as well as nature, or non-human nature as well as human nature. That was important. And this idea that you don't just train community activists to be conservationists or health workers, the two jobs are in a way combined. And it's important to see those two things together, and the health of nature and the health of humans is interlinked. I think that's very strong. The question, again, going back to the question we're asking everyone, do you think, in the areas where you work, that this pandemic has helped people understand that protecting indigenous and local land is helpful to protect biodiversity, and as a result can help to reduce risks of disease outbreaks? Is that happening?
I believe it's happening a lot more. People are realizing the big link between protecting biodiversity and reducing the level of emerging infectious diseases. it's being understood a lot more because everyone used to think it's not linked. But actually, when the pandemic began, people who used to wonder why we're combining the two came and said, now we understand what you've been doing all along. And this was not only at the community level, but also at the government level and the donor community as well. And I think that even within where we live in Uganda, East Africa, people are beginning to realize that we have to protect nature in order to save ourselves. And, you know, a lot of it is like, you have to really support the local communities, you know, make sure that when they have agriculture on their land, it's sustainable, because that's what they used to do before these protected areas were set up. They used to do things sustainably. They used to live with the wildlife sustainably. But now it's a matter of getting them back to doing things in a sustainable way. They don't over harvest from the forest. They protect their land. They use proper soil and water agriculture, and go back to some of the things that they used to do before, which they had kind of given up on. I mean, we even work with traditional healers in the communities to get them to, you know, recognize people who are ill, take them to, refer them to the health centers, but also to continue to protect what they have. The forest is a good resource of medicinal plants, but the more that you destroy it, they no longer have these medicinal plants, and they're not even able to plant them elsewhere because everything is changing. The whole climate and the ecosystem is changing. So it's a matter of working with all the existing cultural leaders or cultural systems that were in place and building upon them to really protect the wildlife. Some of our cultures, you know, I, for example, come from the lion clan, and I'm not, in my clan, you're not allowed to kill or touch a lion because it's a big taboo. And everybody has a different plant that they're, oh, whether it's an elephant or a particular plant. My mom is from a certain plant. And the way that it works is that there's always going to be a group of people that protects a certain species of animal or plants within our culture. And so all these things, people are realizing that if you want to avoid future pandemics, you have to go back to preserving culture and preserving nature and preserving, you know, the rights of people who are living in certain places. So yeah, I mean, in a way, the silver lining to the pandemic has been that we need to be much more careful about conserving nature and looking at it as a way of keeping us all healthy.
Thank you, Gladys. Thank you all for these comments. We are now moving on to question and answer a little bit later than planned, but have a fair bit of time. We already have quite a bunch of questions, but feel free to add to them. Don't forget at the question and answer button at the bottom of the screen. Let's start. Thank you to my colleagues who've filtered some of these questions for me. There is, okay, the top question, it's addressed to Eric and Carlos. So this question, the researchers have successfully trained communities in DRC to use technology to monitor and report signs of Ebola before spillover occurs. And IPES experts worked with indigenous hunters to assess extinction risk. So the question is, what role do you see for local communities as partners in protecting human and planetary health? So very much building on what Gladys has just told us. But Eric and Carlos, from this sort of bigger global perspective, what are your thoughts on that?
Okay, you said my name first. I'll start and then hand to Carlos. It's essential. I think any health system that is divorced from the people it's supposed to serve won't function very well. And so in the context of those kinds of interface environments, working with people who live and use those environments is really important. We've heard Gladys's examples. Sometimes it may simply be around surveillance, and sometimes technology can help with that, reporting systems and so on. But otherwise, ensuring that there is a means by which the people at those interfaces have a voice to speak of the things that are going on there, and report that through the system where it needs to be heard, so that appropriate actions or preventative actions can be taken. So I don't think we can divorce the actions that need to be taken at those interfaces from the people who live at them. The two are completely intertwined.
Carlos.
Yeah, that's a good question. And actually, there are absolutely. I think the indigenous people and local communities can play an important role in surveillance systems. And there's been some interesting examples. For example, in Bolivia, a few years ago, there's as part of a project that I was working with. There's a local community living very close to a protected area. They were working with us, and they observed different, like a bunch of monkeys that howler monkeys that were dead. And immediately, one of the teams examined these animals, and they found that these animals were, they had yellow fever. So so there was a immediate response by the
das
public health
plantas, sim.
authorities
Fala que
to
eu
prevent
não posso
a
agora, que eu tô
pandemic
numa reunião. Assim que eu
yellow
terminar,
fever
fala que
in humans in that area. It's possible to do that, and there are systems. For example, in Thailand, there are a few systems you can see. If you see a dead animal, they take pictures, and then they send it to a center, where there are like veterinarians. They can assess immediately if these animals are, what are the diagnosed of resistance, because they are far away areas, and then they can help even potentially prevent local outbreaks. This is developed for domestic animals, but then can be easily expanded to other, monitoring other wildlife.
Thank you. The next question, this is for all of you, but maybe as Eric and Carlos have already spoken on the first one, we could focus on Gladys, Georgie, and Francisco for this one, but later, Eric and Carlos, happy to chip in if you wish to. So this question is, how would you see the global North and Western countries, wealthier countries, making up for decades of colonizing and resource extraction that have resulted in the mass deaths of indigenous communities and resulted in environmental and infectious disease ramifications that we see now? So basically, I suppose this is a question of responsibility. It's a question of inequality and how to address that. And yeah, some of the things might have costs. Who should be paying? If any of you, Francisco or Georgie, Gladys, whichever of you would like to start, just jump in.
I'll come first. I think everyone is so interconnected today. And as you yourself mentioned, a lot of the very destructive policies, money or law, actually emanates from these powerful governments in the North, right? And also the overconsumption of goods are also emanating from the North, right? So acting on structural changes in your own countries and societies will actually be very important in lifting the pressures away from, for example, indigenous peoples. Because indigenous peoples are, in a way, are survivors. We have navigated at how to address these problems, but a lot of them emanate from unequal wealth, unequal laws, and even a lack of understanding that modern societies have actually much to learn from indigenous peoples, and that these impositions of knowledge from coming from the North needs to be addressed in our own minds and in everyone's own practice and behavior.
Thank you, Georgie. Francisco or Gladys, would you like to address that? Francisco.
Creio que país como o Brasil poderia, né, os governantes poderiam ser mais inteligentes e observar como os países de primeiro mundo já conseguiram, né, descobrir coisas que foram muito danosas nesse processo nessa fase de descoberta, de crescimento. O Brasil não pode mais repetir, né, falando um país como o Brasil, erros que em outros países já foi descoberto que não é o caminho correto, né? E tem que procurar não fazer, viver ignorar as experiências dos outros países. Eu acho que é preciso fechar, né, acompanhar um pouco o debate global, que ali aponta muitas questões que já foi provado, né, de que não é o caminho correto. E estão tentando corrigir muitas coisas, às vezes. Porque por mais que tenha atingido um grau de um avanço muito grande, mas tem muita coisa ainda a ser feito para que tenha uma população totalmente, plenamente com seus problemas resolvidos. Está muito longe ainda disso, por mais que seja países de primeiro mundo, mas ainda tem muito problema. Mas já tem indicativos que pode fazer com que países em desenvolvimento não repita erros que esses, né, no princípio das suas histórias, cometeram. Então, acho que esse é um ponto. Uma outra questão que eu acho importante é que os países, mesmo de primeiro mundo ainda conseguem receber produtos que são produzidos nesses países, quero citar aqui o Brasil, que são retirados de maneira ilegal, de desmatamento, que causa grandes impactos aqui, não obedece à legislação ambiental para poder explorar os recursos. Ainda tem um mercado muito grande de produtos brasileiros que não respeita, né, a legislação ambiental, que não respeita os direitos dos povos indígenas, que está no mercado, no mundo todo. Então, acho que é possível trabalhar uma linha que comece a dificultar esse mercado. Esse seria uma linha que eu acho que uma linha que poderíamos adotar como uma estratégia. Não adianta você cobrar do Brasil e estar comprando do Brasil um produto ilegal.
Thank you, Francisco. Very important. Yes, that connection between what's happening here, in a consumer nation, and what's happening there. Gladys, did you want to address this too?
Yes. Just to add on to what Francisco has just been said regarding consumption of products, responsible consumption, it's very possible for people from the global north to really support the global south. For example, during the pandemic, it's been widely seen that tourists, because of the lockdowns all over the world, people have not been able to travel to these places where they can spend money at wherever they find, the wildlife and the people. But if there are ways that you can export these products abroad, and for example, if someone's buying coffee or tea, they'd rather buy tea or coffee that's been, bought at a fair price and is helping smallholder farmers and is helping not to destroy the environment. And I would just like to give an example of, we started a social enterprise called Guerrilla Conservation Coffee, where the farmers around Windy Forest, we found that they were not benefiting from tourism directly. So we decided to give them a better price for their good coffee, which is then sold all over the world. But it was mainly being sold in Uganda until the pandemic occurred. And then we started to look for markets elsewhere, like the UK or the US and New Zealand. And in this way, then they don't have to enter the forest to poach to survive because they're getting money. And other people in the community are now trying to sell their crafts abroad. So responsible consumption is one very good way of support of the global north supporting the global south to keep things going and help to protect nature. At the same time, I think it's very important for the global north to really recognize that it's much more sustainable to train people and build the capacity of local groups in the global south rather than only bringing in, you know, experts from abroad to do all the work that people locally should be learning to do for themselves. Because this then enables a long-term capacity building and ownership of the solutions and helping things to be on a long term to get the countries in the global south, you know, to come from being underdeveloped to improve, you know, to reduce poverty in these countries and raise their standards of living on a long term. The global north can help with training and things like that. But if they start implementing the work that people are supposed to be doing for themselves to get themselves out of poverty or, you know, get themselves out of destroying their own habitats, then it basically you just keep on perpetuating this cycle that keeps going on for decades and decades. So I think that's something that donors and, you know, need to find better ways of supporting biodiversity and health in such situations.
Thank you very much, Gladys. The next question, going back to Eric and Carlos, there's a few on this line, but they basically all say, well, along the lines of, if One Health had been properly implemented 5 years ago, how could it have made a difference in this COVID crisis to make the epidemic less severe? Whoever wants to jump in first.
Okay, Carlos, I'm happy to cede the floor to you unless you want me to start.
Go ahead, Eric. Go ahead.
Okay. So One Health is not a new concept, and organizations, individuals, scientists, the public have been working or thinking in a One Health context to some extent already for many years. And that's helped us understand the interconnectivity between ecosystems, between hosts and reservoirs and so on. And as others have rightly said, the fact that something like COVID was likely to occur at some point wasn't a surprise to those who'd sat down to consider it. And there are lots of places, lots of areas which we haven't really discussed very much, where the One Health concept is also very relevant in terms of food systems, for example, and the connectivity of farm to urban populations who might consume food and so on. So, with respect to the question, the fact that an event such as the jump of a virus into the human population would occur, we knew that was happening. We were sort of ready, but we weren't doing enough surveillance in order to catch where and when that might actually happen. And so I don't think we can blame One Health on that. What we need to say is that the approach and then the response to the occurrence of that event wasn't particularly well handled, and it dragged on too long, and it was allowed really to become an outbreak, an epidemic, and then a global pandemic. So I'm not sure One Health could have prevented that from happening, but certainly One Health can help us understand that is likely to happen, and then we need to work with people who are responsible for surveillance policy effectively to put in place stronger surveillance so that we can detect when that happens and that we can respond to it more quickly.
Thank you, Eric. No, I didn't mean to suggest, and I don't think the questions mean to suggest that One Health is responsible in any way. I suppose the question is, if you could implement it more thoroughly and more countries took it more seriously and put more resources into it, how could it have helped? And I think you did address that. Thank you. And Carlos, if you could also tackle that.
No, I completely agree with Eric. It's a matter of resource mobilization through these type of approaches. Another example, interesting example, is the Ebola outbreak a few years ago in Liberia and Sierra Leone. There's some, like in 2014, so it's hundreds of thousands of people got infected with Ebola. And after learning about this, horrific problem, the Liberia government implemented a One Health approach that is embedded in the government now. So they learn by living through this extreme problem, and they now have this implemented in the government. So now every other week, I believe there's reports from not just from the public health component, but also from the environmental sector, but also for the human and the animal sector. So everybody's working together. They learn from this problem, and they now implemented that. There are new initiatives, similar initiatives in other countries. I believe Cote d'Ivoire also, I think, implemented something like that. And the great thing about this is that more people are learning and understanding this problem, and they're trying to implement a One Health approach into their legislation, into their government. So it's a lesson learned, but now we need to start mobilizing resources and training more people on this topic.
Thank you, Carlos. You remind me of an interview I had last year with Roger Frutos, who's a specialist in infectious diseases at the University of Montpellier, and he also predicted that a huge pandemic would happen. And he said to prevent this in the future, he told me, we need a massive international cooperation and investment to encourage monitoring and education at a local level. So yes, protection of land rights is important, but also investment at a local level in building up surveillance systems and then responding so you catch things early. And again, of course that will cost a lot of money, but look at if you don't do it, how much we've all paid. I'd love to get in, if we went a little bit further and everybody kept their answers very short, I'd like to put a last question to you. And if you could just keep it to 2 or 3 sentences, your answer, I think will not be too late. But it will be this question for all of you. Looking forward, this is an epic year with a COP for the climate. It's an epic year with a COP for biodiversity and lots of other reasons. If you could do one thing to sort of promote this idea of Indigenous help to prevent pandemics, support for Indigenous land rights, at that level, if you could send one message to those policymakers, what might it be? And again, please do keep it brief because we're actually at the end of our time, but it will almost be like your final headline that you leave with. So maybe we could start with Joji. Sorry to put this on you.
Thanks, Jonathan. So the governments are now negotiating a new biodiversity strategy, which is supposed to be adopted. And the message we're sending them is that if you want to succeed in conservation, in sustainable use, and protection of ecosystem, species, and genetic diversity, really respect the rights of Indigenous peoples and put that in our strategy.
Thank you, Joji. To the point and very precise. Next, Eric, if you don't mind.
Yes, so the scientific community has been saying a lot of what I and others have been saying today for a long time. And what I would say to those groupings of people is that ministers of finance need to now listen and need to allocate the resources necessary for a lot of what we know works to be put into action. And if the finances aren't available at national level, at international level, and at the very local level too, then we can keep talking, but things will never really change. So we need that financing, and that is demonstrative of commitment.
Totally agree, which is why I emphasized at the beginning, look at the costs if you don't do it. We could have that again. And so let's find that money. Gladys, please.
Yeah, I would say that, just echoing what everybody's saying, it's very important for, yes, Ministers of Finance to put more resources into both human and animal health care, because we often find actually that when you have diseases, there's much more resources going into human health than animal health when you have disease outbreaks. And then once you've dealt with case management, the source of the disease outbreak remains because there's not enough resources to prevent it or to do enough ecological monitoring. And so government should put more resources in healthcare in general, and also to support communities to, to improve on their livelihoods. And I think that's very important. Thank you.
Thanks, Gladys. Francisco, please.
Eu creio que, em termos de política pública, no nosso caso aqui, Brasil, avançamos bastante. Agora precisa sair do papel, precisa se tornar real, né? Temos quero dar um exemplo aqui da legislação ambiental, que protege, né, as florestas, protege as nossas comunidades, e que agora está se trabalhando no sentido contrário das conquistas que a gente teve. Então, acho que ela tem que deixar de ser uma questão só burocrática, ela tem que ser real, tem que estar no espírito da pessoa, tem que estar na alma essa vontade de cuidar de maneira coletiva pelo um bem tão precioso como os conhecimentos das populações tradicionais, dos indígenas e da toda a biodiversidade.
Thank you, Francisco. Embedded in our souls. What a fantastic message. And finally, Carlos, please.
Yeah, thank you. So two things. I think it's important to recognize that the rights of indigenous people is and securing rights for indigenous people is essential. It's cost effective. So we need to start talking with policymakers in economic terms. So because that's what that's the language they understand. And second, that we need to make sure that indigenous people and local communities participate in the negotiations at all these high events that we are discussing. Usually those people are not represented for by their authorities, and we need to make sure they are there speaking, raising their voice.
Thank you, Carlos. Thank you all. I think we've had some amazing discussions today, some really strong, bright ideas, indigenous networks across much stronger than we even have now. The need to focus at a community level, to link human health, animal health, nature health, the idea of embedding nature protection in our souls. I mean, all wonderful, wonderful messages. And also reinforcing that this is, and it makes economic sense. This isn't a cost. Doing nothing is the cost. I think that, this has been fabulous for all of those reasons. So thank you to our panel. Thank you again to our hosts, the Ford Foundation, the Land Portal Foundation, the Tenure Facility, and Thomson Reuters Foundation. Thank you to the translators, Luciana, Cynthia, Maria, Sarah, Sandrini, and Natalia. Thank you to all of you in the audience for watching and staying with us. Sorry we couldn't use all of your questions, but I hope it was as enjoyable and as intellectually stimulating for you as it was for me. Please, there will be a survey. You can see a link. There will be a survey about this that I hope you can fill in. Don't forget, this recording will be available in a few days, so it can be a very useful resource. And please look out for the next episode of this Land Dialogue webinar series. Remember, there's one a month. And with that, I will say thank you all and goodbye. I wish you a wonderful rest of your day, wherever you are.